So tell us what your protocol is. What, somebody comes to you and is like, I don't know what else to do. Please help me. What's the first steps?
The first step always, and I probably should have mentioned this in your earlier questions, is to regulate cortisol levels.
Oh, okay.
I mean, when I see my patients, there's a lot of stress happening, right? Most of them are, stuck in their sympathetic nervous system. Cortisol is dysregulated. And as you know, when people are in that place, they can't heal, right? So we have to transition to the parasympathetic nervous system. We have to regulate the cortisol. And as we start that process, then I start looking at their diet, and I institute an anti-inflammatory diet. Usually that means eliminating gluten, eliminating dairy, eliminating sugar. And once we get those inflammatory foods out of the way, we get the cortisol regulated, then the body's really set up to heal much more efficiently. And at that stage, then I start looking at supporting detoxification in the body, and also healing the gut. Those are the next steps that I do.
So how do you do that? With supplementation? Do you recommend coffee enemas? What do you do?
So for detoxification, there's always the supplements that I recommend. I have like a beautiful herbal formula that I use. I love NAC. I'm also a huge fan of complex homeopathy, especially to mobilize the lymphatic drainage. I think that's such a key part of supporting detoxification that's often overlooked. And I'm also a really big fan of castor oil packs. I find that those are really effective at, helping the body detoxify as well. Again, that really works with the lymphatic system as well. I tend to really love moving the lymphatics and supporting phase 2 liver detox.
So do you use the castor oil pack on the liver, or do you actually use it on the face as well?
No, I do not use it on the face.
Okay.
I find that castor oil put all over the face, if you're prone to acne, can really cause some serious pore clogging. Don't do it. Okay. I tend to put the packs on the liver.
Okay.
And we start slowly. I mean, castor oil packs are incredibly powerful. People underestimate their power. So often if somebody has acne and they go ahead and do like 3 castor oil packs overnight in 1 week, they'll have a massive detox reaction. So you have to start very slow with the castor oil packs.
How often do they do them then? Once a week or?
At the beginning, I would say no more than 30 minutes, 1 to 2 times a week.
Okay. So how do you heal the gut? What are some of the things that you do to help promote gut health?
So I always look at gut health as there's 2 phases of healing the gut. The first phase is eliminating inflammatory foods that are just fueling the fire of inflammation in the gut. Supporting motility, so making sure things are moving through the digestive tract, and also healing the gut lining and making sure digestion is happening. So that's kind of my first phase of gut healing. And then I go in and I work with the microbiome on a deeper level. I do prebiotics, probiotics, and antimicrobials as well, if indicated. So that's my little protocol.
Okay. And so do you do stool testing, or do you just have a general program that you recommend?
I love doing stool testing. I love doing GI map testing. I would say that's my favorite test right now.
Yeah, very beneficial. Yeah, it gives great information. Now, so explain to us what the connection is between the gut and the skin. I mean, how are they related?
So there's something called the microbiome, which is a community of trillions of microbes. And the microbiome primarily exists in the gut and on the skin. So if the microbiome in the gut is dysregulated, that's actually going to be reflected in the microbiome on the skin. So it's such a direct connection between the two. And, whenever there's something going on with the skin, whether it's eczema, psoriasis, acne, anything, we always have to take a look at the gut and see what's going on there.
Very interesting. Yeah. Now, what are some topical things that you recommend with somebody who's got some skin issues?
The first thing that I always recommend is to nourish the moisture barrier, nourish the skin. I mean, often, especially acne patients, but many other people too, we've been conditioned to over cleanse the skin, to over exfoliate the skin, and that damages the moisture barrier. And that often leaves the skin vulnerable to infections, dryness, irritation, scarring, pigmentation. So the number one thing is always use, very skincare that's made for sensitive skin, and to be very mindful of how often you're using certain products. And over cleansing and over exfoliating are the two things that I see happen incredibly often that really damage women's skin and make it worse. I mean, prone to acne and even prone to aging more.
Okay, so I guess I shouldn't exfoliate every day then.
Well, some people can handle it.
Yeah.
Some skin types can handle it. Some people can't. It depends on the skin's level of sensitivity. I can do it every day, no problem. But some people just can't handle it.
Right. I guess after sunscreens and, tennis and sweating, I exfoliate pretty often. So I'll be mindful of that.
Yeah.
Now, as we age, our skin loses its elasticity and we produce less collagen. So what can women do that you recommend that could really help support that aging process?
The number one thing that we can do to help our skin age beautifully is to quit sugar. That's the number one thing.
Wow.
Yes, because there is a process called glycation, and it happens when there's high levels of glucose in the blood. And these glucose molecules, they attach to proteins or fats, and this creates something called AGEs. And this is more prevalent in the skin than any other organ in the body. And it can cause your skin to look up to 10 years older, really easily. So giving up sugar, that's the best thing you can do.
Wow. Okay. Now, are there any particular products that you recommend over others? I know there's retinol, there's alpha-lipoic acid. I mean, there's all these different things. What do we do? Where do we start?
So topically, you're talking? Okay, so let me see. When you're aging, you have to do some type of exfoliation. Even though I just said don't over exfoliate, as you age, your skin cells, they don't regenerate, as frequently as they used to. So we have to help that a little bit. So using some type of acid, like an alpha hydroxy acid or a beta hydroxy acid, if you're more prone to congestion, that is very helpful. I love using peptides. They're great just to really nourish the skin and help build up the collagen and elastin levels in the dermal layer of the skin. Retinols, they can also be very helpful. There's a lot of clinical research behind them. They really help regenerate collagen, and they're also great natural exfoliators at the same time. However, they don't work for everybody. I mean, they can help acne, they can help aging, or they can actually make acne worse, make the skin overproduce oil and just create kind of a swamp. So works for some people, doesn't work for some people. Also some type of really nice humectant, like a hyaluronic acid, to really get moisture, to get plumpness into the skin. That's also a really nice topical ingredient that you can use.
Okay. And I've seen people recommend red light therapy for their face. How do you feel about that?
I love red light therapy. So the red light, that's a wavelength of UV light, and it penetrates just into the dermal layer of the skin. So right in the exact place where we want to generate collagen. So it can be a really effective therapy. You have to use it on a consistent basis to really see the effects. And it's also very calming for our nervous system. It helps regulate our circadian rhythm as well. So it's a really nice treatment to use for many different things.
Good tool to have.
Mhm.
All right. And so I guess the last question is, so what are the top things? I mean, I know you mentioned sugar, but what else really causes our skin to age?
Inflammation. I would say inflammation causes the skin to age so much that there's actually a term called inflammaging. It causes
Wow.
aging throughout our entire body. And in order to quench inflammation in our body, we have to take a look at our diet, ensuring that we're not eating a lot of inflammatory foods. Take a look at our gut health and making sure that our microbiome is balanced, because when the microbiome is not balanced, it triggers the production of inflammatory cytokines, which really affect inflammation throughout our entire body. Detoxifying properly, that's really important. Regulating our circadian rhythm, making sure that we're getting the rest that we need, regulating our cortisol. I mean, there's so many things.
Right.
Sorry.
Fresh air, not too much sunshine.
Being happy, having fun. I mean,
Right.
that is all part of the equation as well.
Definitely.